So President Trump has been given the steroid drug dexamethasone as part of his COVID-19 treatment after his blood oxygen level dropped twice in recent days. The president is also being treated with 2 experimental drugs. His team said Sunday that the president was, quote, up and around and doing well. So for more on this, we want to bring in Dr. Elfenbein. He's an emergency care physician and author of Surviving Coronavirus, an ER Doc's Perspective. And while Dr. Elfenbein cannot speak specifically to the president's case, he can give us some better insight on his treatment and what we could see next. So we really appreciate you joining us. So let's talk about this steroid, because I've heard a number of different things. I've heard that it's only used if the case is severe. I've heard that it comes with side effects that may be concerning, particularly mental side effects. On the flip side, I've also heard that it's a very widely prescribed steroid and there's nothing to be concerned about. So what can you tell us? What could this indicate about the president's current condition, and are there side effects that we should be, thinking about?
Well, good morning to both of you guys. So dexamethasone is a very, very widely used drug for a number of reasons and a number of treatments for different ailments. In this case, the NIH recommends treating COVID-19 with dexamethasone only when the patient is requiring supplemental oxygen, which in this case, we already know that the president did, at least for a few hours. So I don't necessarily think that it's off sort of, outside the box to be treating him with this. Some people would argue, well, it's only for people who are really sick, or some people would argue for, well, it's, we should use it on everybody. I think that again, we go back to what the NIH says, and they say when you're being treated with supplemental oxygen, this is when it's indicated. So I don't really know for how long he was on a supplemental oxygen. The reports were that he spiked a fever and his oxygen saturation dropped, so then he required supplemental oxygen for a couple of hours. I don't know what a couple of hours means. It could be 2 hours, it could be 6 hours, it could be 8 hours. I don't know, and I don't think anybody else knows. There are, so what dexamethasone is, it's a corticosteroid, and it's a great anti-inflammatory drug, and the flip side of it, though, is that it reduces your sort of the response of your immune system. So it makes your immune system not function as well, which in this case could potentially make it that you could get more sick because your body can't fight off the virus. So it's kind of walking a fine line there, whether to treat with this or not. In this case, my gut feeling tells me that they were just trying to throw everything they possibly could at him to get him as well as possible, as quickly as possible.
Dr. Elfenbein, you wrote this book on surviving coronavirus, and I know every patient is different. I understand that, but I was looking back at the way things went with Prime Minister Boris Johnson in the UK, where for the first couple of days you heard much the same, that his aide said he's still working from 10 Downing Street, he's doing well, he's responding, and then it wasn't until about day 8 that they decided, and 7 or 8 or 9, one of those days, much later in his at the moment that he was infected, that he had to ultimately go to the hospital, and then things deteriorated very quickly before he was able to bounce back. Now, I understand getting this cocktail of medications that the president is getting may mean a different outcome for him, but what should we be watching over the next couple of days? The president can go back to the White House if that's what he chooses to do, or he could stay at Walter Reed, but what's more important, I think, is what the virus is doing to his body. And so where would he be potentially day 4 in the infection?
That's a really good question, Vlad, and I'm glad you brought that up. So, I think they're trying to portray a rosy picture, which is understandable. I mean, the man is the commander-in-chief, and he's the most powerful person in the world, and they do have an image to uphold, and I think that's what they're trying to do to the world and to the American people. Be that as it may, he is 74, 75. I forget exactly how old he is, and he's got some weight issues and some other medical problems that puts him in a very high-risk category. And you're right. Just because he looks good after 2 days or 3 days doesn't mean that he's out of the woods. So, you really kind of have to give him some time and see how this thing progresses. And I think that's why they're being so aggressive with treating him, because he is in a very high-risk category, and he has a pretty, it's a high risk of bad things happening. So I think they're trying to be as aggressive as they can. And I don't know that there's a timeline to look at to say, well, if on day 4 he's doing well, this can happen, or day 5. I think you kind of have to just give it some time and see what happens over the next week or so, because this virus can last a while and people can get very sick from it.
Can I just ask just about that, doctor? So what is it when people, some people recover, like you hear a lot of stories like that where people will say, you know, I struggled to breathe in day 1 or day 2. I had, you know, some fever, but then I started to feel really good. And I thought, oh, I've beaten this thing. And then all of a sudden I got worse. What is happening in the body when somebody has the initial symptoms and then seems to feel as if they're recovering and then gets walloped again? What's going on there?
You know, that's a great question. I wish I knew the answer to that. I don't understand it. I don't think we understand it scientifically as of yet. You know, and it's very different for everybody, right? Some people will, as you say after 2 days, oh my God, I was on my deathbed, I recovered, I felt great, and then they end up in the ICU. You know, after they were out feeling wonderful and you're going for a walk or something, and the next day they're in the ICU. Versus somebody who gets mild symptoms throughout their entire course, or it's very, very good question. I don't know that we know the answer to it. My guess is that it has to do with the modulation of your immune system and how over time your body responds to it, because we know that coronavirus causes a hyperinflammatory state in people, and it triggers the immune system to be on super, you know, guard, basically. So it ramps it way up. And in some people that can become a problem because it kind of pushes those people over the edge to have too much of an immune response, which is why the steroids are really important, because those people that get that inflammatory syndrome from COVID-19, the steroids kind of mitigate that. So I guess that's probably why they gave him the steroids initially, was they were concerned because of his age and his risk factors that he potentially could develop that. So, you know, I don't know the answer to your question, Vlad. It's a great question.
So what's your take on the fact that he's sort of, like you mentioned, kind of this kitchen sink approach, that we've got the steroid, we've got remdesivir, and, you know, there's 3 things that they're sort of treating him with. Perhaps this is the normal course of action. It seems like a lot, but what's your take on it?
Yeah, I think that they're just trying to throw the kitchen sink at him. So he's getting remdesivir, the 5-day course of remdesivir. He's getting dexamethasone, and he's getting this monoclonal antibody, which is a completely experimental drug that hasn't been even peer reviewed yet. So, you know, I think that they're just really trying to just get whatever drugs they have that have been shown to have any sort of efficacy in people like him to you know, try to make him better as fast as possible.
Doctor, the president made a brief drive-by visit to supporters gathered outside Walter Reed Medical Center yesterday evening. He was wearing a cloth mask inside the presidential SUV. He had 2 Secret Service agents with him in the vehicle. They were wearing what appeared to be N95 masks, also what appeared to be gowns. I couldn't tell, really. It's not a good shot. Yeah. But we've seen an attending physician at Walter Reed Medical Center say that this was completely irresponsible. He says that those Secret Service agents need to be quarantined. He says that, and I'm going to read the tweet from Dr. James Phillips. He says the presidential SUV is not only bulletproof, but hermetically sealed against chemical attack. The risk of COVID-19 transmission inside is as high as it gets outside of medical procedures. The irresponsibility is astounding. My thoughts are with the Secret Service forced to play. What is your take?
Well, first of all, I mean, it does appear that from what I saw as well, that they were in gowns and actually face shields, too, as best I can tell. And N95 or N100 masks, it's hard to tell. I would have liked to have seen the president in an N95 or an N100 as well. Is it a little bit irresponsible? Yes, I probably. Again, I go back to the point that they're probably trying to portray an image. You know, I'm exposed to people with COVID-19 all the time. I don't have to quarantine because I'm in PPE. So I would disagree with the doctor by saying that as long as those Secret Service agents were legitimately in PPE, they don't necessarily need to quarantine. Again, according to my understanding of the CDC guidelines. But, you know, I'm not a politician. I can't speak to what went into those decisions. But my guess is that it was probably just trying to portray an image of strength to the world and to the American people. Is that a little bit irresponsible? From a medical standpoint, probably yes. But from an image standpoint and from a, you know, the presidency's a big job and there's a lot going on. So I can't really speak to that, nor can I speak to what what goes on inside that SUV, because I don't know anything about whether it's hermetically sealed, whether there's supplemental oxygen, whether there's the ability to make it negative pressure, at least for the person in the back seat. I don't know, so I can't really speak to that. But is it a little bit irresponsible to take somebody who's got COVID-19 and who's sick out on a ride like that? Probably a little bit, yes. I would agree with that.
So for our viewers, then, Dr. Elfenbein, if they or someone they know is infected with COVID-19, should they at all tell our audience what you should do, a normal person, if you know somebody or if you yourself are infected with COVID-19 when it comes to isolating yourself?
You should isolate yourself, no question, for 10 days from the time that you were diagnosed, at least with at least 24 hours of symptom-free, no fever, no cough, no shortness of breath in the tail end. So people should definitely be self-isolating, no question about it. You shouldn't be getting in cars with other people and things like that, if that's what you're asking. I mean, absolutely.
That is. I'm just, giving the information. If the president isn't going to practice the recommended guidelines that the CDC and others have put out, just want to make sure that our viewers understand what they are. And thank you for sharing them with us.
Absolutely. Yes, totally agree with you. Yes.
Thank you, Dr. Ron Elfenbein. As always, we appreciate it.
Thank you, guys. Stay safe.
You too.